Hello and welcome to another edition of Time with Your Gynae. My name is Patricia Roxanne Hammond. Today we'll be discussing bleeding in early pregnancy, what causes it, who is at risk, and what are some of the symptoms. Our gynae today will be telling us all after this break. Welcome back to Time with Your Gynae. Today our gynae is Dr. Promise Sefogah. He's a consultant obstetrician with Shape Healthcare. He's also a lecturer at the University of Ghana Medical School. We're going to discuss bleeding in early pregnancy. Doc, I've experienced that before. The trauma alone is something else because I lost the first one, I lost the second one, and the third one I was asked to be on bed rest. So I decided to just go to the market, get some few things to come and prepare food. Then I can relax in the course of the week. I came back and I started bleeding.
Oh dear.
I started crying. Then the following day, my husband had to take me to the hospital. The first question the doctor asked me was, "What did you do?" Like, I didn't do anything. I just went to the market to get some few things.
So you had what we call recurrent pregnancy loss.
Okay.
Yeah, because that was the third time.
But he told me I was bleeding around the baby.
Yeah. So I mean, essentially, bleeding in pregnancy or bleeding at any point in pregnancy is not normal.
Okay.
Okay. There may be a bit of spotting or light bleeding around the time the pregnancy is forming. So this is what happens. When the egg is released from here, the egg comes down through the tube, and the sperm is also released here. The sperm travels up and meets up with the egg. So what we form here is called the embryo. And that embryo travels down between 5 to 7 days back into the uterine cavity. Okay, the inside of the womb. And that is where it implants. It gets attached to the wall of the inside of the womb. And that is what we call implantation. So sometimes there may be some slight bleeding around that time. Because as at that time, the woman does not even know she's pregnant yet. So that implantation happens, and then we're able to detect about another week after that the woman is pregnant. From then till delivery, it is not normal to see any bleeding. When there is any bleeding, it is a sign that something is going wrong, which has to be checked.
In this case, in my case, I was told I was bleeding around the baby.
What?
He was trying to explain things to me, but I think I was just
traumatized
because I had lost the first one, second one, and trying to. I've been blessed with the third one and all of these. I think I wasn't paying attention. So today, I think I need all my answers.
You do,
I believe some people might have gone through either what I went through or even worse. But today, Dr. Sefogah will explain it all.
So bleeding in, so we divide a pregnancy in 3 parts. The first 3 months, second 3 months, and the last 3 months. So first trimester. So bleeding in the first trimester usually means that there is something wrong with the implantation or how stable the pregnancy is. Okay. Most of the time, it has to do with one important chemical in the woman's body during pregnancy called progesterone. The progesterone is needed for the pregnancy to stay. Now, where the egg is released from, that is where the progesterone comes from. And we need a certain level of the progesterone to support the pregnancy. And just because everybody is different, somebody may not be producing enough of the progesterone. And as a result, the pregnancy does not get that amount of support. That's one. Other times, somebody will bleed early during pregnancy because the baby did not form well. And because nature normally doesn't support abnormal things, nature is trying to push it out.
So we just expel everything.
Exactly. So it starts with bleeding, and there may be a bit of cramping. Other times, the pregnancy itself has become something that can be cancerous. We call it molar pregnancy. And that is an emergency because if it is not dealt with, it can lead on to become cancer of pregnancy.
Cancer of pregnancy?
Yeah, just so we can understand.
Okay.
It's called molar pregnancy.
Molar pregnancy.
And that forms when either 2 eggs are fertilized by one sperm, or 1 sperm fertilizes, or 2 sperms fertilize 1 egg. You know, we need 1 part from the mother, 1 part from the father. But if there's a mismatch, that gives rise to what we call molar pregnancy.
Okay.
And that can also cause bleeding. Sometimes the pregnancy gets to implant in the tube, we call ectopic.
Yeah, that's another topic for discussion.
Great. And just because we're talking about bleeding, sometimes in the first trimester, some bleeding can result from the ectopic. Okay, so when a woman is pregnant and within the first 3 months she sees bleeding, she needs to report it, because it could just be that she will need some progesterone support. It could be that it is what we call threatened miscarriage. The pregnancy is threatening to miscarry.
Yeah. If
you don't do this, I'm going to miscarry. I'm going to miscarry. It could be actually that she has miscarried. It could be that it is an ectopic, which is a life-threatening thing, potentially. It could be that it is molar pregnancy.
Okay.
Okay?
Yeah. So in my case that I was bleeding around the baby, I remember I was given progesterone.
Right.
Just to support. I think I took it for like
a couple of weeks.
No, it was even more.
Right. Yeah. Depending on the severity, we give it for various duration. So bleeding around the pregnancy means that the placenta has formed, but it is somehow separating, because the placenta is supposed to attach to the wall of the inside of the uterus.
Okay.
But it's beginning to separate, to peel off, and there's bleeding behind it. It only means that the thing is threatening to miscarry. If the baby is formed well with progesterone support, it will be able to stay.
Okay.
But if the baby did not form well, no matter what you do,
the body will expel
it will come out. Yeah.
So who is at risk?
So
the
woman, not necessarily.
Is it a fault of the mother or the father or the semen?
Right.
Yeah.
So it could be any of these. The woman's age is always a factor.
Oh, we come back to the age again.
Because, yes, when a woman is 35 years and above, there's always a question about the quality of her eggs.
Okay.
Because the woman is born with the eggs already in place. So after 1 year, the eggs are 1 year old. The eggs are growing. So from 35, there's significant reduction in the quality of the eggs. Okay. And so those eggs are prone to miscarry when they get pregnant. Other times, through no fault of the woman, her ovary is not producing enough progesterone.
Okay.
Now, the first 3 months, the progesterone should come from the ovary until the placenta is formed and it takes over that function. Okay? Other times, somebody has fibroids. So the presence of the fibroid is disturbing the proper implantation of the pregnancy.
Even with what if, okay, in this case, sorry to cut you.
No, go ahead.
I know the ones that threaten pregnancy is when it's virtually competing with space.
Yes, when it is inside the uterus. We call it submucous. So the submucous fibroids are the ones that would be likely implicated when there is bleeding in early pregnancy, assuming the woman has this type of fibroid or this one. Okay, and the pregnancy comes to settle very close to it or right on top of it.
Yeah.
That will not implant properly, and that is likely to have some bleeding and may actually do miscarry. Right, so fibroids is a part. And some people have some abnormalities of the uterus. They are born with it. So the uterus is not formed well. And so as a result of that, the pregnancy goes to hide somewhere. It can't have enough space to develop. It will bleed and miscarry. Certain medications as well. Maybe the woman does not know she's pregnant and she's carrying on at some medications that are not safe in early pregnancy. It can cause a bleeding and then subsequent miscarriage.
So in this case, when you realize you're pregnant, is there medication you can take just to prevent the bleeding?
So, we give folic acid, which is a very important supplement for all pregnant women. As a matter of fact, it's important for the woman to even be taking it before she gets pregnant.
Okay.
Because it helps to improve the quality of the egg. And so even when you're pregnant, it is even much more important. So that is very good for everybody.
Okay.
Now, we forgot to mention that sometimes the problem is the quality of the sperm as well. So you can have a good egg, but a bad sperm, and the pregnancy is not very good. It may also suffer miscarriage. Okay. And then a lot of physical exertion, traumatic things, jumping in very early pregnancy, you know, excessive exertion.
Okay.
Or trauma.
Okay.
Yeah.
Is stress a problem?
Stress may not directly, but maybe through other means.
Okay.
Yeah.
So, from what week to what week would you? Okay, you said 3 months. So, like in 4 weeks, 5, 6 weeks.
Yeah.
That's too early.
To what?
For the bleeding, early bleeding.
No. So, like we said,
so around like around what week would you term it as too early or too late or something?
So you never should bleed during pregnancy.
That's it.
Yeah, because when you are pregnant and you see any bleeding, you don't sit at home.
What was the difference between that and then the implantation bleed?
The implantation bleed would happen before you even know you're pregnant.
Okay.
Yeah.
And what's the color?
It's just a bit of bright red bleed. It may not be so much.
Okay.
But once you have missed your period, you have done the home pregnancy test.
And
it is positive. It's positive, right? Any bleed you see thereafter is abnormal. Do not sit at home with it, because the causes could include ectopic, which is potentially life-threatening.
Anything you are not supposed to bleed in early pregnancy.
Yeah.
We'll continue with this discussion after this break. Welcome back with Time with Your Gynae with Dr. Promise Sefogah. He is with the Shape Healthcare. He told us that when you're pregnant, you are not supposed to see any bleeding. Immediately you see that, you need to report to the doctor. And I want to find out.
Yeah.
You mentioned that it could be as a result of the man's semen not being quality enough to support the egg. So in this case, what do we do?
No, I mean, this is not under anybody's control. So like I said, if the pregnancy does not form well, it is not likely to stay.
Okay.
And it wouldn't stay, it means you will bleed. So it could be that a good egg is fertilized by a bad sperm, or a bad egg is fertilized by a very good sperm.
Okay.
Or there's a bit of problem with the sperm, a bit of problem with the egg. It wouldn't be able to form a normal pregnancy. And so naturally it would miscarry.
Okay.
So bleeding in early pregnancy is a sign that we would put together as threatened miscarriage. Then we now come down to look at the possible causes.
Okay.
Right? Like I said, it could be from pregnancy that is sited at the wrong place, we call ectopic.
Yeah.
Or so many other causes like we discussed.
Okay. Is it also a sign of preterm birth?
So preterm birth is slightly different, because now the whole pregnancy should last up to 40 weeks, 40.
Yeah.
The first 13 weeks we said is the first trimester. Then up to 26, 27 weeks, that's the second trimester. Then till 40 weeks, right? Now after 28 or before 28 weeks, the baby is not able to survive outside the womb. Okay? So we say it is not viable.
Okay.
Right. Now from 28 weeks, but before the 37 completed weeks, it is preterm.
Okay.
After 37 completed weeks, we are good to go.
Okay.
So that preterm, the baby coming preterm, could be, it could start just as a bleeding, spotting, or just normal labor, the contraction of the uterus.
But what I want to understand is that when you bleed in early pregnancy, is there a cause that you have a preterm birth?
Oh, right. Yes. A small percentage of people who bleed in early pregnancy stand the risk of having a preterm delivery.
Okay.
Yeah.
Is it that the progesterone could not help
No,
enough
it just
for them to get
no,
to the 40 weeks?
Not necessarily that, but it's just an indication that you're likely to have preterm delivery if you had threatened miscarriage. But again, not all the women who have threatened miscarriage or bleeding in early pregnancy do have that. But it increased the risk of preterm delivery slightly,
okay,
compared to the one who did not bleed in early pregnancy.
Referring to your card, you said with the kind of fibroids that causes slight bleeding, when the woman conceives, and then there are this threatening obstacles.
Yes, so these are fibroids that are located inside the uterus,
yes,
where the pregnancy is supposed to settle.
In this case, when you see slight bleeding, is there a way you can help it apart from the progesterone? Or what if the progesterones do not help?
Yes, so if it's just that the woman requires some progesterone supplements, we give it and that's it.
Okay.
Of course, what we also recommend is bed rest. Stop physical exertion for a couple of days or weeks till you stop bleeding completely and until the first trimester is over. We also are going to say stop or avoid heavy lifting, because each time you are lifting something, you are increasing the pressure in your tummy.
Okay.
That can risk losing the pregnancy when already it has told us that it is not stable.
Okay.
And we say avoid sexual intercourse all through the first trimester.
Okay.
Right. Now, there are other reasons why the pregnant woman will bleed after the second or after the first trimester, and that's what we're going to talk about.
Okay. So I want to find out. Okay, before my other question, if you say bed rest, stop every physical activity, let us understand. Is it that you don't wake up from bed, you're just in bed and you're treated like Queen Elizabeth?
Yeah, but you're not well. Typically, when that happens, you'll be kept in the hospital.
Is it in all cases that you have to be kept in the hospital?
If it's that bad, it depends on how we assess the risk.
Okay.
So we're able to say, oh, this woman, she's 37, 38 years. She's been trying to conceive for 7, 8, 9, 10 years. She's managed to conceive. She's bleeding. The scan we've done shows that the baby is alive. The heart is beating. We see evidence of bleeding. We need to admit her.
Yeah.
She doesn't go moving from Malata to Abubuluchi to here, go and carry it. No. Go carry a bucket of water, go driving Banku. No.
Okay.
So she's kept in the hospital for bed rest. Right. That helps to prevent worsening of the condition.
Okay.
As a way of contributing to help the pregnancy to stay. That's what I mean.
Okay.
Then when we're able to do that and the bleeding stops eventually and you're being discharged home, then we say take it easy. Don't lift heavy things, don't have sex, and the other precautions.
Okay. What was sex? Okay, the pressure.
Yes, the pressure. It shakes the uterus and doesn't help.
Wow. So in the case of this kind of fibroid, knowing very well the pregnancy is threatened, can you do anything about it? Maybe try to shrink the fibroid to help the pregnancy?
No, not when you're pregnant. No. So when the woman has fibroids, the fibroid makes it difficult to conceive unless you remove it. Some would conceive and the fibroid will make them miscarry. Some would conceive, carry the pregnancy till term and deliver. Once the pregnancy has come, despite the fibroid, all we do is to try to support it as much as possible. If for some reason she miscarries and we think it is because of the location of the fibroid, then we need to do something about the fibroid before she conceives again.
Okay. So in that case, you need to give her medications to support the uterus again?
Yes, take out the fibroid first before she conceives, and if necessary, she'll be put on some supplements to support the pregnancy further and minimize the risk of a miscarriage.
If I'm trying to conceive and I've looking at my history, I've already experienced I've experienced miscarriage and then bleeding in early pregnancy, and I want to conceive again.
Yeah.
Do I need to be on supplements, or should just
precisely
go ahead just to prevent? There is a saying that when you go through something for the first and second time, the possibility of it repeating in the next 2 or 3 pregnancies is very high.
Yeah. So yeah, it's the same thing in obstetrics. So if the woman has a miscarriage before, the chance of having it again is higher than somebody who did not have it before. And so what we do sometimes is to put a woman on certain supplements, sometimes even the man, even ahead of them conceiving.
Men have to do supplements?
Yes, sometimes we do that. Like I'm saying, because if we have cause to think that there was something wrong with the formation of the pregnancy in the first place, it could be from the egg, it could be from the egg, it could be a bit from here, a bit from here. So sometimes we actually send the products of the miscarriage to the lab for chromosomal studies. And then if we find that there's a reason to give supplement to the man in addition to the woman before they conceive, as what we call preconception care, we do that.
So apart from bleeding in early pregnancy, I also heard of bleeding in late pregnancy.
Yeah.
How serious is that?
Yes, so...
And what actually causes it?
Yes, so again, those are major complications of pregnancy.
Okay.
Being in early pregnancy, we've spoken about, mostly it's an indication that the pregnancy is threatening to miscarry. Yeah. We're able to stabilize it in the majority of cases, and the pregnancy can carry on. Except, like we said, it is not formed well, where naturally it would miscarry. Yeah. Okay. In late pregnancy, two main things would cause the bleeding. Okay. One is what we call placenta previa. You want to say that after me? Placenta previa. Good. So placenta previa only means that the placenta, which is the bridge between the baby and the mother, naturally or normally the placenta is supposed to be situated at the upper part of the uterus. So for various reasons, the placenta would now come to the lower part of the uterus. So a placenta that is in the lower part of the uterus is what we call placenta previa.
Meaning it has peeled off?
It hasn't peeled off. So the one that peels off, so when the placenta is in the lower parts, and as the uterus is expanding, a bit of it will be shearing off. It will be tearing off. And that is what causes the bleeding
in late pregnancy.
In late pregnancy, as a result of the placenta being in the lower part of the uterus.
Okay.
Another type, the placenta is at the right location, all right, but it is peeling off ahead of the delivery.
And what causes that?
So again, first of all, that is called abruptio placenta.
Abruptio placenta. Okay.
Or placental abruption.
Okay.
Okay. Now, when the woman is pregnant and she has very high blood pressure, it can cause that. Okay. Or sometimes the cord which connects the baby to the placenta, the cord is a bit too short through no fault of anybody.
Okay.
Okay. So as the baby is moving, then the cord is stretching and is peeling the placenta. Sometimes that happens. Other times the water around the baby is so much that when the waters break, the pressure comes down suddenly inside the womb, and that can also cause the placenta to peel off. Now, the placenta previa and the abruption of the placenta, they both cause bleeding in late pregnancy.
Okay.
But one of the bleeding comes with a lot of pain, severe pain. One does not cause pain.
Okay.
Both of them are potentially life-threatening. They can lead to death of the pregnant woman easily, death of the baby easily, death of both easily.
Before we wrap up, I'll just have to fix that in your final words.
Yeah.
Around what weeks does someone experience this?
So this typically is, the bleeding is after 28 weeks.
For 28 weeks,
yes.
Okay.
Any bleeding before 28 weeks we consider as threatened miscarriage, like I said, because after 28, it's from 28 weeks that the baby is viable.
Okay.
That stand a risk, a good chance of surviving when outside the womb.
Okay.
So this bleeding from 28 weeks up until delivery or up until term, any bleeding is called antepartum hemorrhage.
Okay.
Bleeding before delivery. And like I said, the majority of the causes is abnormal position of the placenta, or the placenta is peeling off when it is not yet time.
Okay, Lord, when I said Lord. Doctor, please, your final words. I want to find out. So in this case, how do you help the woman?
Yes, so in majority of it, depend on the severity. If it's a previa and it's not a heavy bleed, and the baby is too far from 37 weeks, we keep the woman in the hospital, bed rest, just doing close monitoring, doing the scan every twice a week or every week, and then there's some injection we give to the mother to help the baby's lungs to mature a bit.
Okay.
Because if the baby is born before 34 weeks, the lungs are not matured enough. So try to buy time. Let's mature the lungs with the injections. So in case baby will come out, baby can do a bit better outside.
Okay.
And then we try to buy time, 1 day at a time, to see if we can carry the pregnancy till term.
Okay.
Then we deliver normally through cesarean.
Okay.
Okay. But if it is the bleeding from the abruption where the placenta is peeling off, we have to deliver the baby.
Okay. Okay.
Because if you delay, the placenta would peel off, and that disconnects the baby from the mother. No more food, nutrient, oxygen reaching the baby.
So the
baby will die. And then the mother will get complications where her blood will not clot again. And she may also be on the way if you don't intervene early.
So what if, in the case of high blood pressure, you're giving her the necessary medication to still reduce the pressure, and it's still the same, you have to take the baby out?
Yes. Once there is those complications, we have to end the pregnancy.
Wow.
And also control the blood pressure.
Pregnancy, it's a whole lot.
Yeah.
You are not supposed to bleed in pregnancy, either early or late. Any of them, when you conceive and within the first, second, third trimester and you see blood, as doctor advised, you have to rush to the hospital. Shape Healthcare is always available for you. My name is Patricia Roxanne Hammond, and the show has been Time with Your Gynae. Our gynae has been Dr. Promise Sefogah. He is the consultant obstetrician with the Shape Healthcare, and he's also a lecturer at the University of Ghana Medical School. It's been nice having you on this show.
Thank you, my pleasure.
We'll be right back. We'll come back with another issue, because it looks like with gynaes and women,
there's always something to talk about.
There's always something to talk about.
No problem.
So the next time I come, I have another thing to talk about.